Hi, I hope you are keeping a social distancing and you are well and you haven't caught the COVID-19. I've been reading a lot recently about what's going on, and it seemed like that we need to start concentrating on a blood as the main causative problem rather than the lungs. The problem with the COVID, it comes in and goes inside your red blood cell and disconnect the iron out of the red blood cell, and this free circulating iron start predisposing to thrombosis and infarcts in the lungs and in the kidneys and the liver. The first sign of it, you're going to have thrombocytosis, and then the next sign that you have a very high storage of iron in the liver with increase in the transaminases, and then the third sign, you're going to start having a kidney problem and kidney shutdown. So the problem is that to allow the oxygen goes to the tissue, and the best way to do that is to treat the problem in the blood rather than in the lung. Definitely, if the patient coming in is extremes and need ventilation, need to put a tube in and ventilate it. But the problem is before that. Avoid intubation on an emergency basis. Try to give oxygen as much as you could and give medication that dissociate the problem of the virus from the cell. They have seen that, like treating the malaria. Malaria is a parasite goes inside the red blood cells. When you give the chloroquine, it allows the DNA to go out and kill the malaria. The same applies. It doesn't kill the bacteria, but it allows to disengage the DNA of the red blood cells, at the same time increase the pH of the blood and kill the virus and prevent its replication. This is what goes in. So, however, after all of that, we have discovered that also hyperbaric oxygen is a good idea, and whether we're going to use it on hyperbaric or use all of these parked airplanes on the tarmac as a mobile hyperbaric chambers where we could give some prostacyclin and NO. Please keep safe. Try to prevent problem arising. Treat the patient as early as you can and self-isolate. And I hope I'll be able to talk to you after this pandemic is over. Thank you, and keep safe again.